Hey guys, this is Kevin again. Today I want to talk to you about healthcare in the Philippines. As a licensed insurance broker here in the States and an agency owner, um, I thought it was important for me to do some research on the healthcare system in the Philippines, especially for anyone who's considering visiting or retiring in the Philippines. Um, I want to share some of the findings of the different companies that I came across, as well as give you a general overview of some of the things that I thought that would be important. Um, Please keep in mind that just like with any healthcare system, they are always updating their systems, their plans, and making changes to improve. The first thing that I found that was pretty unique is that you will have to pay up front before the doctor sees you or the hospital accepts you. So you're not going to get back there to be seen by the doctor or admitted to the hospital unless you pay up front. So that's why it's so important that you have your finances together and make sure that you choose the proper insurance plan because one medical emergency can literally devastate your entire retirement savings. Also, make sure that you do your own research, guys. Find out which plan is going to be the most suitable and the one that fits your health needs. Keep in mind that some of the areas in the Philippines may be better suited for you to visit or to retire than others, especially if you have some type of pre-existing condition. Uh, if you decide to live in the province areas outside of the main city, hospital treatment can be limited. So that's something you want to keep in mind and be aware of, especially if you have some kind of long-term medical condition or illness. To help identify the differences in coverage, there are two sectors. There's the public sector and then there's the private sector. So for the public sector, yes, we're talking about PhilHealth. PhilHealth is a national government owned health insurance program that provides health insurance coverage and no. So from what I found, AXA was one of the most expensive plans. However, it did offer the most features and ease of access for foreigners looking for health insurance in the Philippines. Number two, Sun Life Fit and Well. Sun Life, they've been around for many years. Now, they have many different healthcare packages available for foreigners. The most common insurance package is the Sun Life Fit and Well. It is a health insurance plan that offers critical illness and life insurance benefits up until age 100. Sun Life states that they can diagnose 64 major critical illnesses, 34 minor illnesses, and 16 specific cancer conditions within the plan. Now, similar to AXA, prices differ from person to person. However, they do have an online advisor and several offices if you prefer to see them face to face. Number three, Cigna. Cigna is best if you secure the health insurance before arriving in the Philippines. Cigna offers four plans in total for expats. These include the silver, the gold, platinum, and close care. Silver, gold, and platinum plans cover worldwide insurance, excluding the US. However, the close care plan covers country of residence plus country of nationality, which may be a great option for some travelers. However, please note that the close care does not cover as much as the platinum plan. Okay? From what I observed, I'll be honest, these plans are not cheap, but they offer full coverage, including private rooms, full cancer care, and other conditions as well. Number four, Pacific Cross. Pacific Cross is a part of the Pacific Cross International Group. It's a group of companies which operates in Hong Kong, the Philippines, Thailand, Vietnam, Indonesia, and Cambodia. Now they have worldwide coverage, I should say. However, they do not cover pre-existing conditions unless specifically agreed prior to the start of the policy. I did see somewhere that it stated pre-existing conditions are not covered for the first 12 months. So I need to do a little bit more research on this particular company. And by the way, it is cheaper to purchase the plan once you get to the Philippines. They also have a plan that's a peso plan as well as a dollar plan. Now, the peso plan is actually cheaper, but it only covers inpatient benefits, and the dollar plans covers both inpatient as well as the outpatient, and it actually offers more coverage. Here are some additional companies that are offered in the Philippines. Now, I'm not going to get into too much details. I'm just going to mention them. So if you want to do your own research, feel free to do so. So we're talking about BPI AIA, PRU Life UK, FWD Philippines, Kaiser International Group, Caritas Health Shield, I hope I'm pronouncing that correctly, Manulife Philippines, Metacard, and Maxicare Health Corp. Now, what I've heard so far in doing my research, it appears that Pacific Cross and AXA seem to be the best primary carriers for foreigners and expats. However, I do encourage you to do your own research, as I mentioned several times, to see what would be the best coverage for you in your situation. Again, guys, thank you for watching my channel. Please like and definitely subscribe. And until next time.